Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Eliza Andrews, who is the owner of Inspirit Therapy Associates based out of De Pere, Wisconsin. As a physical therapist and pelvic health clinical specialist, Eliza considers herself a puzzle solver for her patients, and she loves helping people find the root cause of their symptoms. She discovered early in her career that a whole body approach was the key to quicker recovery, so her practice combines traditional treatments with lifestyle management, nutrition, and emotional support. In 2009, Eliza became one of the first PTs in the nation to earn the Women's Health Clinical Specialist designation, and she has been a leader in the pelvic health therapy world ever since. When Eliza is not helping patients, you can find her working on a DIY remodeling project, reading, or spending time with her husband, kids, or grandkids. In our 4 episodes together, her experience of over 30 years shines through as we discuss numerous topics related to pelvic health therapy, including an overview on what pelvic health therapy looks like, symptoms specifically related to kids like bedwetting and constipation, how pelvic health therapy can help treat reproductive challenges such as endometriosis or irregular or painful periods, and how pelvic health therapy can be a game changer for women in the childbearing years. Get ready to learn a ton? Here we go with today's conversation.
Hey guys, welcome to the podcast. We're super excited to welcome Eliza Andrews here from Inspirit Therapy. Welcome.
Thanks for having me.
Yeah, we're super excited to have you. She is a pelvic health physical therapist, and we're really excited about this conversation. We have a little bit of background in pelvic health as well, and we're excited to get this information out to you guys. So before we get started, a lot of times we like to kind of talk about you a little bit. So your fun fact is that you like to remodel projects. You like to do DIY.
Uh-huh.
So tell us a little bit about that. Like, what are some recent stuff you've been doing?
My current project is I'm turning an old entertainment center into a dress-up theater for my 4-year-old granddaughter for Christmas.
Oh my.
So that's my current project. We're also in the middle of taking a bathroom and gutting it to the studs and redoing that, which, as you know, that's a thing.
Oh, yeah.
So is that a part that you're not as excited about as the remodeling piece?
No, actually, I love doing that.
Oh,
so
okay.
probably my first when I bought my first house, it was a 1903 era house, and I gutted it and did it all. And I was single at the time, so I did most of it by myself. So I've been doing this for a long time, but yeah, no, I like doing it. The hard thing right now is there's some stuff that's hard to get. But the little thing for Rosie has been really fun.
Oh, that's so sweet.
What other like projects do you like? Is it typically furniture related? Do you do upholstery too?
All of it. All of it. I can, yeah. My thing I probably hate the most is painting.
Sure.
But it's probably just because I hate picking the colors. Like, that's my thing. So, my daughter-in-law is very, very talented. So she comes over and she gives me she's like, do this. And then I do it.
That's awesome. I could definitely use your help around my house. That's for sure. I got lots of projects that I would love to do.
Yeah. It's fun. It's fun to take something old and make it new again.
Yeah. And I appreciate that. I love that. That's awesome. Okay. So let's start talking about, physical therapy and pelvic health. So first of all, how did you become interested in physical therapy? Tell us a little bit about your story.
So I was a freshman in high school, and I decided I was going to run track. And I got hurt and couldn't run, but I still wanted to be part of the team. So my high school track coach said, well, why don't you go ask the trainer if you can learn how to help us tape ankles? Because we always need help with that. So I went and met the trainer, and he said, I can't teach you how to tape something unless you know the anatomy. So I'm going to have to teach you some anatomy. So I would go twice a week after school for an hour or two, and he taught me anatomy and athletic training. So I was a student high school athletic trainer, all 4 years of high school. And then when I was getting ready to go to college, I thought I wanted to be an athletic trainer. And Jim, my mentor, said, you really should get a PT degree. Back in the 90s, athletic training wasn't actually a degree. It was just a certificate. So you had to pick a different college track. And he said, so go get a PT degree, because then you can do stuff in the clinic or on the court. And if your athlete gets hurt, you can follow them in the clinic. And so you should be both. And then I went to Marquette University. I was an athletic trainer my 4 years at Marquette as well. And then completed PT. So that's how I got into it.
Okay.
I wasn't actually ever going to be a PT. I was going to be an athletic trainer.
Okay. So then how did you get into pelvic health?
Right.
Because you know, when you think of PT, I think a lot of people think PT like, oh, they're going to help me fix my, my
rotator cuff.
Yeah, right. Like I got injured or I got surgery and now I need to recover from that.
Right.
So I think ortho.
Well, and especially being an athletic trainer in the background, that's what I thought. I thought I went to college. I was like, I'm going to get out and I'm going to work with like high level athletes, and it's going to be this glorious thing. And I ended up so far from that. It's kind of funny.
Yeah.
But my my second student clinical rotation, my CI was pregnant, and I would watch her like move and not move. And it got me just kind of curious about that. And then my first job after I graduated, I had another couple of, I guess, coworkers that were pregnant. And one of the gals I was working with was interested in working with OB at the time. So she kind of got me interested in working with OB. And I thought it was fun. I was like, oh, this is kind of cool. And then you get interested in, so after they have the baby, how does the body change back?
Yeah.
And so I think that's where a lot of us started 30 years ago, because it was such a new area, new specialty. And then they come to you after they had the baby and they're like, okay, well, now this doesn't work. Or I sneeze and I pee, or I can't get off the floor, or why is my rib cage, 2 inches wider, or what?
Yeah.
And they'd come, you'd see them pregnant, and then they'd come afterwards. And then one thing just kind of led to the next. And within a year of graduating from PT school, I took my first women's health course.
Okay.
So,
and that's when you got like hooked.
And then I was like, oh gosh, yeah, nobody's taking care of these people.
Right.
Yeah. And they fall through the cracks. And then a year and a half, 2 years later, 2 years after that, I was pregnant with my first baby. And then you experience it from the inside out.
Right. Yeah. It's I'm sure it's a whole nother ball game.
Yeah. A whole new level of understanding.
Well, but it's also a little weird when you're like, oh, that's what that is,
Sure.
and that kind of thing. So yeah. And then I just kept doing it.
Okay. Yeah. So what are some common conditions or issues that you feel like you treat as a pelvic health physical therapist?
We probably break it down into a few categories. So there's the childbearing years. So there's all this stuff before a woman gets pregnant. I think that's an area that gets missed a lot, is people don't know that they can do PT even before they get pregnant to make the pregnancy be more successful. And more comfortable. That's huge. But then there was obviously the pregnancy, preparing for delivery, postpartum recovery, all that. So that's one section. Another section is incontinence, both urinary and fecal incontinence. And that doesn't necessarily just happen to, 80-year-old ladies. And so a lot of people don't realize what mild incontinence is. Anybody who's wearing a liner every day just in case, that's a problem.
That's your sign.
That's a problem.
Yeah.
You shouldn't have to do that. And, or if you're like, oh my gosh, when I got to go now.
Yeah.
Or I'm avoiding going places, that kind of thing. Fecal incontinence is not something that a lot of people will talk about, but it's a growing problem. There's a lot of GI things going on that need to be addressed. And so incontinence is not only just leaking, it's also constipation. That's huge. And then we do pain, any kind of pelvic pain, sexual dysfunction. We do work with dysmenorrhea, pelvic pain related to bad periods. So teenagers, I get a lot of young girls that don't want to be on the pill or can't be or whatever. And then we do treat, pelvic health therapists do treat kiddos, little ones. So bedwetters, constipation in little ones, not toilet training or struggling with toilet training. And we treat men as well. So we can treat men with ED. We can treat men with all the same incontinence and pain problems. So I think people don't realize that we have such a variety.
Yeah, for sure. I feel like, a lot of people don't understand that there's way more to it than just like an ortho mindset, right?
So those are a lot of different types of scenarios that you could be helping people with, or different types of symptoms. Is this something that you learned in PT school? But you said that you took your first women's health course like a year after you graduated. Right. So are you trained on this at all in general PT school, or do you really need to get additional certifications to be good in this area?
So when I was in PT school, kind of funny, our orthopedics instructor actually said, he goes, there's a few things I'm not going to teach you. He's like, I'm not going to teach you anything about TMJ because that's a specialty. I'm not going to teach you anything about working with pelvic health. He said, I'll teach you a little bit about pregnant low back pain, which they really didn't teach us anything.
Yeah.
They really didn't. But he said, but those are specialties. So when I went to school, no. People graduating now, yes, they have the opportunity because they've changed the education model so much in 30 years. They've extended it now. It's a 6-year program instead of a 4-year program. They do a doctorate level clinical doctorate. So they get some chances to take some specialties. The organizations that teach the postgraduate type learning, like Herman and Wallace and Alcove, actually allow students when they're in their 5th year, so there's the end of their PT education, they allow them as students to take those classes. So they can start taking those classes even before they have their PT degree, so that they can build that if they're interested. And then there is an opportunity for residency programs. So they can, right after they graduate from PT, the regular program, they can take a 1-year residency. They're offered a couple different colleges. I don't know all the schools that do it, but I know University of Minnesota is the one that's closest to us here. So they can actually do it. It's still a specialty. It's very much a specialty, but they can start it before they graduate now.
So if somebody is experiencing any of those symptoms that you had mentioned before, and they're considering looking at a PT, and their brother is like, oh, I went to this PT for my shoulder, he was great. Like, what should they be looking for in a PT to make sure that they're going to be well taken care of for those symptoms? So
first of all, I want to clarify. So there are PTs and OTs. Okay. Occupational therapists in pelvic health. It's a newer specialty for OTs, but I'm super, super excited that OTs have joined us in the pelvic health realm because they have a little bit of a different training than PTs, and they bring a unique perspective. So it's really cool. So you can definitely look for both physical and occupational therapists who qualify themselves as pelvic health specialists. The questions I would ask, number one, I'd ask, how long have you been doing this? How many people have you treated? Not that newer people aren't, everybody's got to start somewhere, but you want to know that this person's been doing this for a little bit of
time. And they specialize in pelvic health.
And they specialize. Yeah. Ask them how many classes they've taken or where they got their training, what they've done. For me, the gold standard is if someone does actual internal pelvic floor examination. And let's not lie. Nobody loves that part of it, right? We all go when we have to have our annual exam. But you cannot know what's going on in a pelvis if you don't go into the pelvis. And there are some therapists who will tell you that they can help you without going internal. And that is true. There are lots of things that can happen without going internally, but you're only going to get 50% of the picture. So there might be some things that get missed. Sometimes I'll get people who've been somewhere without an internal exam and they're like, well, I didn't get any better. It's probably because something got missed because the internal exam didn't happen.
Yeah.
So what does that actually look like? I feel like that can sound really scary to people, like you said, especially, I guess it's not especially. I was going to say right after you have a baby, you're like, I am so done with people being in that area. But regardless, like if we're talking about incontinence, even in older ages, things like that, it can still be intimidating or scary or being like, I don't want to do that. So what does that actually look like to the internal exam piece?
And do you have a different perspective for people instead of being like, oh, they're going down there?
Right.
Yeah.
Well, the number one thing, it's so funny. When I will have a patient, we'll get done doing the internal and they're like, oh, that was not what I expected. So the first thing is no speculum.
Right.
No big shiny light. I'm not crouching down and putting my face in there. My patients, when they come in, we use actual sheets, fabric, no paper. So they come in, they're laying between two sheets, they're completely covered up. I will do a visual exam, but it's pretty quick. It's just basically to make sure I'm not missing anything really crazy. Because sometimes there are skin conditions and things that can cause pain. And so many women don't look down there.
Yeah.
So many people
It's like taboo.
Yeah, and they don't know. They're like, I don't know what that looks like, or I don't know what that's supposed to look like, or they have a vision in their head of what they think it's supposed to look like, and they've looked and theirs doesn't look like that, and so then they don't want to look again. Let's be honest. Vulva are as different as noses. Nobody's nose is the same as anyone else's nose. Nobody's vulva is going to look the same as any other person's. So yours is unique, and we should embrace that, and we should be like good with that. But that's not the mentality we have in this country, unfortunately. So it's pretty, so I take a quick peek to make sure there's nothing huge. And then you're covered up. You're completely covered. I'll put a blanket on you. I'll keep you warm. And then while I'm doing the exam, I'll explain what I'm doing. I'll explain where I'm touching. Most people are really surprised because it's quicker than they think it's going to be. I think that's the other part that surprises them. And like I said, when we get done, people are like, oh, okay, well, that wasn't so bad.
I think like one thing that helped my perspective on this is that you are as a PT, you're looking at the muscles. You're trying to understand what's happening, as they breathe, as they bear down, as, all the things. So it's not like an OB exam where they're like having to look inside and like actually get like something out of it, right?
Right.
You're literally feeling what's happening. And this is different. It's a different perspective. Just like you're feeling a bicep, if there's a tear there, if there's something going on, there's muscles inside the pelvis.
Right. Yeah. And we teasingly say it's orthopedics in a cave because it is really orthopedics. It's just orthopedics. You can't see what's going on.
Yeah.
Yeah. So and I think the other thing that, for people with pain, the thought of something going in can be really, really scary. So I want to clarify, while internal exam is the gold standard, it is absolutely not the only thing we do. So I had a lady come in last week and she's like, I don't think you can do that. I'm like, okay, let's do all the external stuff. So I have to treat a pelvis from the top of the head to the bottom of the feet. I can stretch hips. I can do work through the belly. I can do work through the sacrum in the back. I can do work through the legs. I mean, there is a lot of things there that we can do that are not internal. So sometimes I'll treat someone for 3 or 4 sessions before we do an internal anything. I always ask. I never assume I'm going to do an internal. Also, to clarify for our younger patients, we do not do internal work when we are working with our pediatric patients.
Okay.
That is not part of it, just so that anybody's wondering.
That's a good question, or that's a good point too.
And what you just said is actually something I want to stretch on a little bit more is the kinetic chain side. How you said you look at somebody from top to bottom. Do you feel like having these extra specialties within the pelvic region, because that's the center of our body, and the pelvis is really, it's a huge area. It's front to back, it's side to side, it's up to down. Do you feel like it's kind of made you a more well-rounded PT in general? Because can people get like knee pain that's stemming from the pelvis? And because you have this type of education, you're able to kind of diagnose that and find that quicker. So tell us a little bit about how you feel like this has really benefited you just in your entire PT practice.
Oh, well, I mean, I can't tell you how many patients have come in to me. A great example, I had a patient come in last year, and she came in for headaches and jaw pain. And as I'm evaluating her, I'm like, what is going on with your right hip? She looks at me, she goes, what do you mean? So what's going on with your right hip? She goes, oh, that thing bothers me all the time. I've been in and out of treatment, chiro, PT, whatever. And I'm like, okay, well, can I take a look at it? She goes, well, I'm here for my jaw and my headaches. And
You're
I'm like, okay, let
yeah.
me look at your right
Let
hip.
me just look.
So I treated her right hip and her jaw and her headache pain went away. Like I didn't even touch her above, her clavicles. I lied. I did a couple of things because I needed to teach her some stuff because she had some bad compensatory strategies up there, but it was all because of what was going on in her lower half.
Right.
And she's a great story. She's like, I will never understand that. The other thing is that a lot of leg and foot things really come out of the pelvis. So people who have really bad chronic foot problems, the pelvis is going to have it. And then there's all the referred things. A lot of GI, a lot of abdominal and breathing things come out of the pelvis. So absolutely, everybody needs to have their pelvis included in whatever they're treating for.
That's interesting. I feel like anytime somebody tells me that they have like a, like an issue, it just seems like headaches and something that's totally random, and I'm like, you should just go see a pelvic floor PT. And then they're like, why? I don't have any, like, they are like the most well-rounded PTs that I know. I mean, I'm not over the top, know everything, but from what I understand is like you guys, everything it comes from the pelvis, or if you have flat feet, it can affect your pelvic floor, things like that. So it is just amazing.
What exercises or lifestyle changes do you recommend for people? Let's just say that I have no negative symptoms right now, but in general, do you have any tips for maintaining optimal pelvic health? Whether it's nutrition or lifestyle or just posture or anything else?
Strengthening is important. And a lot of pelvic floor exercises are not Kegels. There's so many other things. So hip strength, just in general, and hip range of motion. I think that's maybe even more than strength is range of motion. The ability to move your hip, 360 degrees is really huge. So mobility, just moving. And that's young people. I cannot tell you how many high school athletes I work with who have got horrible hip mobility, and that's leading them to all of the other things. I think the other thing is just get to know yourself. Get out the mirror, take a look, find out what, I think that's huge. And be pelvis positive. Don't be afraid of your pelvis. Don't be afraid of your sexuality, whatever it is. Don't be afraid of knowing how your body works. Because if you know how it works, it'll click for you and you'll be like, oh my goodness, that makes so much sense.
It's mind blowing.
Yeah.
It really is.
And it's not really that complicated. But we've got the wrong attitude towards our pelvis in this country. And we need to change that.
Absolutely.
Are there any other misconceptions that you commonly hear about pelvic health therapy that we haven't covered yet?
Yeah, there's a lot of them. I think just the biggest one is people assume that if they've seen one, they've seen them all. So if you've had pelvic health therapy anywhere and it didn't help you, find someone else. Because we're not all trained the same. We don't all have the same background. There are some people who will claim to have some expertise they maybe don't quite have. So check that out. The other thing is the fact that that we only do pelvic health, or that it's very niche, but I think we can treat, like you said, other things, and that it's all connected is really important for people to understand.
Awesome. Well, I want to talk just a little bit about you specifically and your business. So where do you take insurance?
We do.
Okay. And then where are you located?
We're located in Pere, on the east side. So about 3 miles outside from the bridge.
Awesome. And something else I love about you is that any pelvic health experts that you bring onto your team, you are becoming well known as the mentor for these experts.
I'm old.
I would not say that. I know we're not on video right now, but I would not agree with that. But you are experienced.
Well experienced.
Yes, which is amazing. And I love that you
I'm
have
in my
a heart.
30th year of doing pelvic health.
That's amazing.
I'd say you know a few things. Yeah.
I keep telling my staff I want a t-shirt that says, I know stuff.
Perfect. Sounds like a good Christmas gift.
Yeah.
But yes, I will mentor anyone who is interested in learning about pelvic health in any discipline. Absolutely. the PTs, OTs, nurses, physicians. If you want to know more, I'm happy to sit down and discuss all of the advancing things, because the amount of research that's coming out and the amount of things we're learning is really, really growing. And we are, like I said, there's no part of health, the health journey that not only women, but men and women and children are on that we can't help them with.
Absolutely. And it sounds like you're going to be heading up some kind of mentoring sessions or whatever. But if people are interested in that, they can reach out to you.
Starting in January, we're going to be doing some pelvic health provider mentoring programs. So they can reach out to me directly and I'll give them the details. It's going to be really clinically focused, but I think it's a good learning opportunity for anyone. We're also doing some community-based education series that'll be starting in 2025. We're going to do one for young girls and what they need to know, pelvis positive program.
That sounds great.
Yeah, I'm going to be doing that with Drea Andrews, who's one of our fitness instructors.
Yeah.
Perfect.
Oh man, that's gold, you guys. If you have daughters, young women, oh my gosh, do that.
If you want them to have a positive pelvic image and healthy sexuality, and understand what it is to have healthy sexuality, this is going to be a good series.
Okay.
Awesome. Well, if somebody is listening to this and they either are looking at you from a patient perspective of some of those symptoms you described, I have questions about those, or from a professional perspective of, hey, I want to just meet you and maybe mentor a little bit with you, what is the best way to reach you?
There's 3 options. So number 1 is a phone call. You can call our clinic. And do you want me to give that phone number?
Sure.
920-338-9670. The other one is email. So email off of our website will come directly to me, actually. I am such a hands-on owner that I take everything that comes off the website. I see it before it gets disseminated to the person who's going to handle it. So that is feelbetter@inspiritpt.com. Or you can reach out on any of the social medias. I'm on Instagram,
Facebook, right?
Facebook, all those things. I think I'm the only one. Yeah, my name is pretty unique in this area. So
awesome. And then can you just share what your website is if they just want to learn more about your place in general?
Yep, it's www.inspiritpt.com.
Perfect. This was a really great intro episode into what does a pelvic health therapist actually do. I love that we talked about how it's not just PT, but there's also OT involved, how the full kinetic chain is involved. Like there's this is just so interesting, and I'm so glad. Yes.
It's men and children, which we're going to get into in the next episode.
Yeah, I'm so glad that we're talking about all these things. So like Drea just said, we do have more episodes coming up. We're going to be talking about kids specifically in one episode. We're going to be talking about dysfunctional menstruation and endometriosis, things like that in another, as well as tying directly into the pregnancy and postpartum timeframe, since that is such a critical timeframe that you really need to be seeing a PT that is specialized during that time. So stay tuned for some more episodes coming up. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.